Welcome to All Home Care Matters, the show where we discuss all things home care, with discussions on important age-related matters and topics. Brought to you by Enriched Life Home Care Services, the #1 rated home care provider in Michigan by Top Rated Local.
Hello, and welcome back to All Home Care Matters. If this is your first time visiting us here at the show, we want to say thank you for taking time out to be with us today. We appreciate how valuable everyone's time is. That's why we try and make each episode here at All Home Care Matters something that hopefully matters to you. As your loved one ages, there are many changes you can expect to face. One major change that affects an enormous part of the over 65 population is hearing loss. Hearing loss affects 1 in 3 people between the ages of 65 and 75, and about half of those over the age of 75, according to the NIA. Even though many people face this ailment, it can still feel isolating and difficult to grapple with. Seniors with hearing loss might struggle to keep up with conversation, hear the doorbell ringing, or even know when the microwave's beeping. This can make living everyday life particularly difficult, especially if the hearing loss gets worse as time goes on. Hearing loss isn't just an inconvenience, it can be dangerous too. A person with hearing loss might struggle to understand their doctor or to hear emergency sirens or other alarms. At the same time, hearing loss can lead to feelings of loneliness and even depression because conversing with friends and family and participating in social events is simply harder than it used to be. It is not uncommon for seniors to not want to admit when they are facing hearing loss. Some feel embarrassed or don't want to admit that there's something wrong. If you notice that your loved one is experiencing hearing loss but they aren't admitting it, try not to get too frustrated. This can be a difficult reality for your loved one to come to terms with. The good news is that doctors can work with hearing loss patients to come up with a treatment plan so that your loved one can continue to live as safely and happily as possible. Treatments might include hearing aids, medication, or even surgery depending on the situation. The sooner you can get your loved one to a doctor, the better a treatment plan will work. We know that hearing loss can be hard to navigate, which is why today's episode of All Home Care Matters is all about understanding why hearing loss happens, how to cope with it, and what current treatments are available. And we hope this episode brings you and your loved one some clarity when it comes to this difficult situation. Age-related hearing loss, also called presbycusis, is an incredibly common condition among older adults. It usually occurs equally in both ears and happens gradually. At first, a person might only struggle to hear high-pitched noises like the microwave beep, for instance. Because the start of age-related hearing loss can be so subtle, many don't even notice when it first begins. One of the most common causes of hearing loss is loud noises. Veterans who have been around gunfire are more likely to experience hearing loss, as are people who spend a lot of time around loud music or in loud factories. If your aging loved one works or lives in a noisy atmosphere, it's a good idea to protect their ears by using earplugs, noise-canceling headphones, and keeping loud noises to a minimum whenever possible. There are many reasons that a person might face age-related hearing loss. Most commonly, this happens simply because our inner ear changes as we get older, affecting the way we process sound. Inside the inner ear, there are tiny hair cells that translate sound waves into electrical signals for the brain to interpret. Over time, it is possible for these hair cells to become damaged or lost completely. Because they do not regrow, this leads to permanent hearing loss. Changes to the hair cells in the inner ear is the most common reason for age-related hearing loss. Still, it is not the only reason. Some seniors experience hearing loss due to changes in the middle ear. This occurs when the tympanic membrane thins or becomes too stiff, which tends to happen to people around the age of 70. There are many types of hearing loss. If your loved one is experiencing difficulty hearing, this does not necessarily mean they are becoming deaf in both ears. Some seniors experience only mild hearing loss, in which they cannot hear high-pitched noises, but can hear everything else, while others experience total loss of hearing. Sensorineural neural hearing loss is the hearing loss that occurs when there is damage to the inner ear. This type of loss does tend to be permanent. Conductive hearing loss, on the other hand, happens when sound waves are simply not reaching the inner ear in the first place. This can happen for a myriad of reasons, from too much earwax to a punctured eardrum. A punctured eardrum can occur as a result of an infection, pressure, or an accident, but it can also be caused by something as simple as cleaning your ears with a Q-tip. Conductive hearing loss can usually be restored when the signal blockage is fixed, either through medication or surgery. Some people experience what is known as sudden hearing loss, which happens when a person loses their sense of hearing completely in a matter of seconds or days. Patients with sudden hearing loss must seek medical attention immediately, as this can be a sign of a greater neurological problem. Hearing loss might also occur in the form of tinnitus. Tinnitus happens when a person hears ringing, hissing, clicking, or buzzing in their ear. The phenomenon can be heard in both ears or just one and tends to come and go. For many seniors, tinnitus is the first sign of hearing loss to come, but it can also be an indicator of other medical issues. Some seniors with tinnitus suffer from high blood pressure, for instance. Regardless of the type of hearing loss, the signs and symptoms are generally the same for every patient. Seniors experiencing hearing loss might notice they have a hard time following conversation, particularly in group settings, need to turn the TV volume up much higher than usual, need information repeated, have a hard time hearing over the phone, or believe that other people are mumbling or not speaking clearly. If you notice that you or your loved one is experiencing any or all of those symptoms, make sure to see a doctor as soon as possible. Hearing loss treatment is most effective for seniors who begin a treatment plan right away. When you book an appointment with a hearing specialist, you will meet with either an otolaryngologist, an audiologist, or a hearing aid specialist. Some people might meet with all three, depending on the severity of the situation. An otolaryngologist or an ENT specializes in diagnosing ear, nose, throat, and neck diseases and will be able to provide resources, support, and an official diagnosis. An audiologist is trained to specifically recognize and measure hearing loss. They will be able to tell you exactly how much loss you have suffered and what to expect down the road. It's important to know what exactly you're facing so you can prepare for the steps ahead, and an audiologist will be able to help with just that. A hearing aid specialist is a professional who can conduct hearing tests to evaluate your needs, fit you for hearing aids, and even provide counseling services as you face the road ahead. Counseling services can be fundamental to many facing hearing loss so that they feel less alone and more supported on their journey. Treatment plans will vary depending on you or your loved one's individual case. Still, there are some common treatment plans that are worth researching and looking into. According to healthyhearing.com, about 1/3 of people with hearing loss use hearing aids. Hearing aids are a device worn in or behind the ear, and it works by making sounds louder, allowing a person to be more present in conversation and aware of any emergency alarms or warnings that might occur. Hearing aids are made up of a microphone, a speaker, and an amplifier. The microphone receives the sound, which is converted into an electrical signal by the amplifier and then sent through to the brain through the speaker. Hearing aids can make an enormous difference for anyone suffering age-related hearing loss and help them get back to living their best life again. If your loved one's hearing loss is especially severe, their doctor might recommend cochlear implants. These are small devices that are implanted into the inner ear during surgery. They are used in people who are profoundly deaf. Less commonly, a doctor might also recommend bone-anchored hearing systems, which are systems that are designed to transfer sound through bone conduction. Other treatments might include assisted listening devices such as iPhone apps or cell phone amplifying devices. The treatment the doctor recommends will depend on the severity of the situation. For many seniors, dealing with hearing loss means facing a new world of uncertainty and frustration. Many people do not want to admit when they are suffering because they worry that they will be excluded, ostracized, or even lose their sense of independence. When a person is hard of hearing, they might need sentences to be repeated again and again. This could lead to the person they are speaking with becoming frustrated and saying, "Never mind," which can be disheartening to hear. The last thing we want is for our loved ones to feel like they cannot be part of the conversation or that their hearing loss has become a burden to us. That's why it's so important to approach communication with patience and empathy, and to make the listening environment as peaceful as possible. When speaking with your loved one, make sure that there aren't a ton of background noises that will make it harder for them to hear. Turn off the television and any music. Close the windows and do what you can to eliminate any other background noises. At the same time, speak clearly and directly using eye contact and hand gestures so that your loved one can read your body language as well as listen to your voice. Refrain from yelling or shouting, which can distort language, but still speak in a louder voice than usual. During conversation, be patient with your loved one when they ask you to repeat something, even if you have to say it again and again. Remember that they are doing their best to listen, and it's not their fault that they aren't quite understanding. Be empathetic with their situation and offer guidance and friendship when they need to vent or get frustrated. This is a difficult reality to come to terms with, so any support they get will be a huge help and welcome. We know that living with hearing loss can be a frustrating and isolating experience, but when you begin treatment and have a wonderful support system in place, you can get back to living the life you love. We want to thank you for joining us here at All Home Care Matters. All Home Care Matters is here for you and to help families as they navigate these long-term care issues. We invite you to please visit us at allhomecarematters.com, where there is a private, secure, fillable form where you can give us feedback, show ideas, or if you have questions. Every form is read and responded to. And please, if you know someone who could benefit from this episode, please make sure to share it with them. And remember, you can listen to the show on any of your favorite podcast streaming platforms and watch the show on our YouTube channel. And make sure to hit that subscribe button so that you'll never miss an episode. Please join us next time on All Home Care Matters, where we will be discussing an entire episode on communication with seniors. Thank you so much.
Thank you for joining us today. We look forward to you joining us again on another episode of All Home Care Matters. To learn more about the show and to connect with us, visit us at allhomecarematters.com.